Hello. Good afternoon, everyone. A warm welcome to the first of our new SIPHER webinar series. My name is Petra Meyer, SIPHER Consortium Director and Professor of Public Health at the University of Glasgow. SIPHER has over the past 5 years used our UKPRP funding to bring together policy and academic experts with practice partners in Scottish Government, Greater Manchester Combined Authority and Sheffield City Council. We use innovative system science approaches to transform public health and well-being. This new webinar series of short lunchtime talks will offer you an opportunity to hear directly from our team about our exciting work to tackle health inequalities and improve the health of the population. Each short 20 to 25-minute presentation will have an audience Q&A session, and a full recording will be available on the SIPHER website after the event. Please feel free to recommend these to any colleagues who couldn't join us today. To submit questions today, please use the Zoom Q&A function, and we'll address these at the end of the presentation. So without further ado, it's my delight to introduce our speaker today, Professor Ellen Stewart. Ellen is SIPHER's Public Engagement Lead and Professor of Public Policy and Health at the University of Glasgow. In her presentation, Public Involvement and Policy Modelling Research, Learning from SIPHER's Experience, Ellen will share insights from 4 years of working with SIPHER's 3 community panels, including lessons learned and reflections from panel members. Please remember to submit any questions to the Zoom Q&A. Ellen, take it away.
Thank you, Petra. Okay, so today's presentation is going to be short and sweet. I'm going to start by describing some of the challenges that we know about and knew about when we were designing SIPHER of involving members of the public in modelling research. I'm going to recap a bit about SIPHER's model for public involvement and what we've done in terms of involving the public in the last 4 to 5 years. We've got a short video to play you of some of our panel members reflecting on their experiences in SIPHER. And I'll draw out some of the key learning points about how to do involvement in this kind of research that we are taking forward into future research. I'm looking forward to your questions at the end, and any that we don't have time for, please always feel free to get in touch with me directly. I love talking about this stuff. So I'm not going to get too hung up on definitional issues. This is a vast literature which could easily be a webinar in itself. But I've been working with the key definition at the National Institute for Health Research, offered in 2015, which is public involvement as an active partnership between patients in the public and researchers in the research process, rather than the use of people as subjects of research. And it's that active partnership that we've been trying to establish, and that in this presentation I'll reflect on some of our achievements and probably failures also in doing so. To very briefly flag, because funders, journals and the broader research infrastructure encourages health researchers to involve members of the public, we have an instrumental rationale to do this work. We need to do it to satisfy our funders. However, me as an individual and also the consortium more broadly bring additional understandings of the value of this work to what we do. We have substantive rationales in that public involvement improves the research. We learn insights from that work, which make the research better and enhance our understanding of the phenomena that we're modelling. And we have normative rationales. So from my point of view, as publicly funded researchers, as researchers whose work serves the public good, we have an imperative to involve members of the public in the work that we do. We're currently undertaking a scoping review with colleagues, some of whom are in the webinar, around how modelling researchers describe the public involvement that they do in their research. And so far, we've found that there is fairly little reported practice in this area. Indeed, because most modelling is predominantly secondary analysis of existing data, quite a lot of modelling papers simply report that they didn't need to do public involvement. There's no formal get-out clause in any of the institutional structures of this that say secondary analysis doesn't require public involvement, but there's clearly some kind of disciplinary norms at play around when and whether this kind of work has to be done. There's a really excellent consensus statement that was published in 2019 by a group of researchers and involvement practitioners, specifically about how difficult it can be to involve members of the public in data-intensive health research, so the big data research that SIPHER is one example of. And one of the points that they make very eloquently in that paper is that data-intensive researchers mostly rely on secondary analysis in which people's complex, sometimes difficult lives are transformed into data points at vast quantity. That means, as the consensus statement argues, that there can be a real distance between the people doing the research, the data scientists, the modelers, and the lives of the people whose social issues they are researching. So, for example, some data scientists might work their entire careers on something like alcohol and yet never spend time engaging with someone who lives with alcohol problems, as an example. So this can limit the way that researchers know an issue. Their knowledge of a social issue becomes funneled through what is available in those big existing data sets, which are a magnificent resource for analysis. And it also can mean that some, by no means all, researchers lack the sensitivity that you might develop if you frequently spent time interviewing people or surveying people or in focus groups with people who are living the issues that you go on to model. Relatedly, a lot of modelling research is essentially maths, and numerical descriptions of phenomena have lots of value, but what they don't tend to be is tremendously engaging or accessible. So modelling research can be heavy on jargon, technical terms. I sit in entire meetings full of people discussing acronyms like SF12, having deep conversations about the meaning of these acronyms. And so that can make it really challenging when you then want to bring publics into engaging with that kind of research. And sometimes over the years, some of my colleagues have sent me slides of graphs that they would like us to share with our community panels, which have, no meaningful real life phenomena mentioned on the slides, just series of acronyms modelled against each other. There are also some particular characteristics of the SIPHER consortium which have sort of accentuated the challenges of this public involvement. And these aren't drawbacks, these are things that we're really proud of in SIPHER, but they bring these additional challenges. So firstly, SIPHER as a consortium brought together researchers from a really wide range of disciplines, some of whom had not been trained in health research. And while by no means all health researchers are profoundly committed to the value of public involvement, it is understood as a kind of tenet of health research. It's been very mainstreamed for about 20 years now, with funders asking the question about what we do. Engineers have not been trained, have not tended to be asked, how did you involve the public in this engineering research, as one example. So we had to work to establish a shared understanding of why this work needed to be done. SIPHER is also co-produced with our policy partners, as Petra mentioned at the start of the webinar. And that means that we need to respond to framings of social issues that have policy traction, that our policy partners think we might be able to do something about if we have a broader understanding of it. That can sometimes be a policy framing which doesn't resonate with broader publics. And I'm thinking here specifically of things like economic inactivity, a huge issue in social policy and in economic research at the moment. Policy partners are very exercised about and want to do something and be seen to do something about. And yet economic inactivity is a fairly stigmatizing language to use. And so sometimes there's a translational role in speaking across those categories and those different forms of language. And finally, because oftentimes in health research, public and patient involvement groups do wonderful work, but they're often, because of the way they're recruited and supported, they're often highly educated, exceptionally articulate and confident people. Because of the range of inequalities that SIPHER wanted to be modelling, it felt really important that our panels were inclusive of a range of things like levels of education and of life experiences that in some cases meant that people lacked confidence and didn't feel particularly safe in interactions with professionals and with academics. So we had to put a lot more effort into the supportive role of our community panels than we might have done in a differently recruited. So the model of public involvement that we chose, and I'm going to go through this quite quickly, partly because some have heard it before and partly because it's written up elsewhere, is that our panels were delivered in partnership with a local community organisation in each of our 3 policy partner areas. So that was Greater Manchester, Scotland and Sheffield. Those partner organisations provided a whole range of support and kind of scaffolding to our panel members, especially to those who were finding some of the process more challenging than others. And they also processed the financial side of things in terms of expenses for our panel members and the honoraria for those who were able to receive those. Our panels were made up of local residents who had a really broad range of experience of different issues that relate to health inequalities. So this included disabilities, mental health issues, experience of homelessness, and in some cases of long-term and extended periods of unemployment. Within these panels, we met two to three times per year per panel, so across 3 panels, to feedback on specific issues in the research that came up. I'm now going to try and play this video. Please bear with us as we switch from one thing to another. I'll stop sharing my slides and I'm going to start sharing our video. Okay, is that showing now? Great. Okay, I'll start playing.
I was a member of the lived experience team with High Voluntary Action, and we volunteer on things to do with lived experience and unemployment and mental health, and giving our thoughts and opinions on whether it's the creation of services or the improvement of services. So obviously this was like right up my street to do with influencing policy change, which was something I didn't know was actually possible to come in and talk about, like going through a certain system and that being useful for a piece of work that's bigger than usual. So yeah, that's why.
Firstly, because I was asked to, but also because of the lived experience parts of the community panels. I'm someone who's very interested in things like co-production and involving people who are nearest to the matter, being able to tell their point of view.
I think some of the best bits is probably how much I've learned from a public way of thinking. So I've always been really interested in how the Scottish Government works and how the NHS works, and being involved from a research point of view was really interesting for me to learn about the synthetic populations, because I'm such a nerd for systems and different ways of showing data and all of that, but also obviously putting my voice of lived experience to going through mental health services and being unemployed. So both of those things together were I loved these meetings that we took part in over the last few years. The worst? Probably the academic speak, right? We constantly had to remind some of them to we're here, we don't understand this jargon that you're saying, and they listened. Thankfully, because of Ellen as well, trying to get that message across that if you want to involve people with lived experience, then you're going to have to speak a bit more simply and translate it over to spoken normal English rather than abbreviations and what do you call them? Acronyms.
I really enjoyed the session that we had today, and I think there's a perception sometimes when you get involved in these things is that people are sort of, it's been a long-term project, hasn't it? It's been 5 years, and that people are paying a bit of lip service sometimes to people with lived experience, and it's a bit of a a bit of a poverty safari type thing, and the reality is that listening to some of the people who've been involved in the modelling and the data and the data collection and some of the decision making, it came across today that they really cared, and I think that's really interesting to know that the people behind the things that are putting it together actually really are doing this because they want to make a difference.
Okay, the best bits are the learning. So the good and the bad, I've been interested in. Ellen is very open, and what I love is, she's quite open if something's gone wrong or if something's gone well, and she's quite open about it, and that's how it should be.
The highlights, I think, were working together in a team, seeing people and me as well, growing confidence and being able to understand or question what we don't understand. And Ellen was quite good at that, and the researchers too. Sometimes I would ask questions that came up, or somebody told me afterwards, and if I never emailed the researchers a question, I got a very fair, clear, spent some time in answering it, which made us feel a little bit more valued, more worthwhile.
So going back to the slides, so that was a short video we made of some of the panel members who attended our closing event here in Glasgow in September, reflecting on their experiences. And I'm really, when I reflect back on what we've achieved through this process, I'm really proud of some of the participant experiences there that were shared, that were broadly positive, not without learning along the way. Where probably I'm less confident, if I reflect on what we achieved and what maybe I would do differently if I had my time again, would be around the extent to which we managed to achieve that active partnership, which yields influence on the research. And the learning that I'm taking from that I hope can be helpful to other people who are seeking to do public involvement work within modelling research. The first one will surprise no one who has dabbled in or had a role involved in public involvement in research. The first was simply resourcing. So there were some real advantages to the model in SIPHER, which is that I led on all the involvement work and was a co-investigator. So the public involvement work wasn't kind of annexed off to a hired hand researcher who's likely to move on to another project partway through, for example. I thought that was a real strength, and it's a credit to the consortium directors for seeking out that model to bring someone in as a co-investigator. However, there were definitely moments when there were missed opportunities, when the constraints on my time meant that we couldn't deliver workshops quickly enough or frequently enough. And so more time and more money, I think, is probably unsurprisingly one of the things that I've learned from the SIPHER experience, and which we have put into practice in other bids that we've worked on since. A second was around two-way learning. I hadn't necessarily anticipated the extent to which my role as public engagement lead involved not just supporting panel members to learn and engage with the modelling research, but to support our research colleagues to learn about the value, the worth and approaches to involving the public. So there was much more of a two-way Janus-faced role than I had necessarily anticipated. It often surprised me which of my colleagues took to engagement sessions like Duck to Water, and others for whom it was maybe very intimidating to join a community panel meeting and share their research, or some who really struggled to do that in an accessible way. It wasn't always as I'd expect, and I think it leans on some skill sets that we don't often see in the academic workplace, and maybe that we should see more of. A lot of my work was around my concern that this was an ethical approach to involving the public. So our community panels involved some people who you could consider and probably would in some cases self-identify as being vulnerable, as having vulnerabilities related to where they were at in their life. Making sure that the workshops were an opportunity for panel members to challenge the research and to have those difficult conversations, but also to keep everyone in that space feeling safe and secure was sometimes really challenging. Before my academic career, I worked as a trainer and facilitator in the third sector, and those facilitation skills were at times really important. It is crucial that this kind of work does no harm, that we bring people into the research and that we don't leave them feeling less good than they came into it. Sometimes those conversations were between panel members, I hasten to add. So sometimes a panel member would express a stigmatizing or negative view about, for example, people who are unable to work for a long period due to ill health. And that would be a description of other people in the panel, which they would find very attacking and difficult to hear. Those moments were some of the most challenging that we experienced across the whole 4 years. I also had to, at some point, let myself off in trying desperately to make workshops as inclusive as possible and recognise that there were trade-offs between different panel members' inclusion needs. So for some panel members, the online workshop environment was just impossible for them to feel confident and empowered to speak up. That never changed for some of our panel members. And yet when we came together in person for workshops, they would come alive and they would be the first person to tell me when a presentation was inaccessible or where we'd misunderstood something. There were other panel members who, when we switched from the online workshops early of the pandemic to our in-person workshops, could never attend an in-person workshop, perhaps due to their own health, to their caring responsibilities. And even if we tried holding the workshops very close to where they lived, it didn't ever feel possible or viable for them. We adopted a mixed approach where we would seek to have a mixture of in-person and online workshops, but that always meant that someone wasn't fully included. And at some point we had to accept that there was no perfect solution there. We could just do our best. I think the work of trying to identify opportunities to influence the modelling research was a much bigger part of my role than I might have anticipated. Trying to spot those moments when a decision was being made about a model or an indicator that we could feed back into and influence was really challenging. It involved both proactive work of me approaching workstream leads and saying, what are you working on that perhaps the panels could help with or support you with? And reacting, so noticing somebody saying that a decision was coming up in a meeting and offering a workshop in response to that. So that takes time and takes a kind of broad-based knowledge of the consortium that also doesn't come easily necessarily. Finally, something that I wish we had started doing sooner within the panels was looking for alternative ways to use the remarkable insight and knowledge that our panel members shared with us. The models that SIPHER builds are deeply constrained by the big data sets that can support that modelling. And so if, for example, panels described a phenomenon in a way that is not captured in any of the measures in, say, Understanding Society or one of the other big data sets, oftentimes we simply couldn't do anything with that knowledge despite hearing it and valuing it. We went on over time to develop products like our layered systems map, which is available on the SIPHER website, to try and do different things with that knowledge. And that became a really significant part of the panel's work and a very rewarding part, I think, for both some of the panel members and for me as public engagement lead. So an example of that would be something around our discussions of housing and health. And we heard often from the panel members how the stability, security of your tenure of housing made a huge difference to their well-being and their stress levels. So being scared of your landlord, being worried that your kid was going to have to move school because they might be evicted in a no-fault eviction next year if the landlord decides to sell up. If there isn't a good measure of housing tenure within the data set, that can't be built into our models. And so we need to think more creatively and expansively about what we can do with the modelling resource that exists within SIPHER. So those are some of the key learning points that I'm taking away that are going forward into the Policy Modelling for Health Consortium that Petra is also leading and which I'm delighted also to be involved in. But I think we should have some time now for Q&A. There are references on the slides which I put there in case people want to follow up, but also please do get in touch with me if you have questions about anything that I've shared. Okay, so over to Petra for our question and answer.
Thank you, Ellen. Yes, everybody, we have now 10 minutes for questions, so please pop them in the Zoom Q&A, and we will try to get to as many as we can in the time available. But Ellen, what a wonderful talk, and makes me very proud to be involved in that wonderful work that you did. So the first question that's come through is, how did you select members for your community panels? And how did you manage to get them to stay with the project for 4 years 5 years now. It's obviously a very long time.
Yeah, and that really, all credit for that has to go to our community partner organisations. I'm so happy that we worked in partnership with these organisations who have really profound knowledge of the local areas we were working in. What I didn't do was, for example, ask our community partner organisations to recruit, say, a demographically balanced sample of the population, which is something that I think some of our public health colleagues sometimes would have liked. It felt important to me that panel members had affinities, that they perhaps knew each other through other activities in their community, and that was a way to build the trust and relationships within the panels, which I think kept people involved. So if someone maybe didn't enjoy one workshop, they could talk to the people that they worked with or volunteered with or knew in their community about it, and hopefully that would help them come back confidently the next time. Overall, we did really well in terms of keeping people involved across the period. I'm so grateful to our panel members who joined us at the height of the pandemic, when we all had a lot of other things going on, and stuck with us as we changed beyond that period. We did lose some panel members, usually due to changing circumstances in their own lives. Sometimes people who perhaps started working full time and so weren't available for our daytime workshops anymore. We also very, very sadly had 2 panel members who died. And that again is what happens when you're working with people with complex, multiple health condition lives in many cases. And those moments also were really challenging for us as a group, but also nice in that we could come together, remember those panel members and their contributions, and kind of carry that forward in the rest of the project.
And I can see the emotional effect that these long-term relationships leave, and the stamps that it leaves on everybody involved. The question 2, I guess, is a bit more technical. It's around any tips on how you manage the issue of technical language and acronyms with your community panel members, or maybe I should add, as chair's prerogative, how did you manage it with us as researchers who are not always used to talking to normal people about that we do?
Absolutely, and there is a lot of learning about this. So I think there's two things that we did that worked well, and this was achieved through trial and error, I hasten to add, as some of the panel videos highlight. This was not something that we got perfect from the start. One was that we worked with the panels to co-produce an information pack and glossary around the kind of research that we were doing. This is available on the SIPHER website. And that was an amazing process of working together to find analogies or metaphors that worked for panel members, checking them with the modelers, because I'm not a modelling researcher myself, to make sure that they were accurate. And then we could refer back to those in ways that was helpful. Ali Brown, who is a PhD student within SIPHER, helped us do that work, and he was a former journalist, so had some of those communication skills which really were helpful in that process. So working on that together, not me producing it and handing it to them, but doing that collaboratively really helped early on. The other thing that I didn't do from the start, and learned the lesson the hard way, was I had to ask researchers coming to the panel, send me your slides in advance, and I would literally go through slide by slide and say, I don't know what this means. What does this mean? Why are you using this terminology? Can you take some of the words off this slide? And send it back. So it was a process of active filtering, which everyone was really kind and generous about doing, because the researchers were also doing this on top of their other responsibilities. But that made a big difference once I started routinely doing that. And on the odd time when maybe somebody didn't manage to get slides to me in advance, it tended to show in the workshops, I would suggest, in what went on.
Yeah, so it sounds like you actually also learned something about what is required in that boundary spanning role. Really interesting, sort of Absolutely. That kind of that forward and backward, and maybe in more involved ways than you had anticipated in advance.
Definitely.
So question 3. Great presentation, Ellen. Thank you. Can I ask whether you used any alternative ways to recognise and reward PPI members? In our research, we've often had difficulties paying low-income community members for their time, even with vouchers, because this can impact their benefit payments.
Yeah, this was a huge, and this is, I mean, it's acknowledged as a huge issue. Organisations like the NIHR keep putting out new reports because it's an acknowledged challenge that frustrates researchers so much. But I'm yet to see a convincing solution to it. So we worked closely with the community organisations to do this, which was a lot easier than paying people through the university, which will surprise nobody that university finance departments are not easy places to get things done. Community organisations, because they were smaller, often were more used to working quickly, just getting stuff done, finding solutions, whereas it often can feel like, with the best will in the world, university finance departments find problems, not solutions. In some cases, we did need to pay people via vouchers, and that's a bit of a fudge in that formally those vouchers could still affect somebody's income and therefore their benefits entitlement. We had to work through that on a case-by-case basis painstakingly with support from the community organisations. The ideal, by some distance, option is that we just pay people for their valuable time. And in some cases that was possible because people perhaps had small part-time roles with the community organisation and it could just be added onto their pay for the month. That was the dream when we were able to achieve that. When we did have to use vouchers, for example, for a period the project sat at the University of Strathclyde, who would only let us use one voucher provider, which was Love to Shop vouchers, which are universally hated, which inexplicably changed their operating model every 3 months. So that just as panel members had gotten confident with using one digital voucher, it would change. It was much better when I found a finance administrator who would support us to be flexible. So some people wanted only a handheld voucher from the supermarket around the corner from their home. And I'll be eternally grateful to Donna Thompson, a colleague at Strathclyde, who managed to find some more pragmatic workarounds, because these things really matter. They're not, it often seems like small fry when you look at the overall budget of a consortium like SIPHER, but it's hugely important that people are remunerated for their time and that is as simple and dignified a process as we possibly can make it. So it's a great question, and I wish I had a better solution other than finding a friendly finance administrator and buying them chocolates.
Well, one thing you mentioned was economic inactivity as being quite stigmatizing language. I thought it was interesting because we hear about that so much, and it's never occurred to me, and that's probably typical of most researchers, that we're not very good at reflecting how these terms might be received, or even if we do, it's not immediately obvious to us. Can you say a little bit more about what's problematic about the term and how one should maybe talk about it instead?
Absolutely. I think it's a really archetypal example of a useful policy term that conflates and flattens really complex social experiences. We can take a gendered analysis here as well, in that economic activity is such a narrow definition of what it means to contribute to society. And for example, some of our panel members who had care and responsibility for children with complex social, emotional, behavioural needs, the work that person is doing in caring for and enabling that child to thrive and to develop is a huge contribution to the economy. Where that work doesn't disappear if it isn't done by that person. Or people who were struggling really, who desperately wanted to be able to work and who were prevented from working because they were living with conditions which made it difficult, and often because the kind of jobs available to them were not jobs where your employer would treat you with respect, would make the kind of occupational health amendments that could enable that person to work. I think sometimes working in universities, we can forget that we have access to occupational health support and that we have proper sick leave and things. If you don't turn up for work for a few days on a 0 hours contract, you'll likely just find that they'll stop giving you shifts. So these are the sorts of complex and really, they go really to the core of someone's sense of their value and what they're contributing to society. So to flatten that under this label of economic inactivity is really problematic. Additionally, then, for us to bring it to community panels and say, here's a policy problem, there's too much economic inactivity, that's a problem for the government. And these people are living that problem day to day, desperately want to find a solution, but it feels to them like they're being told they are the problem. So that's, I think, a really useful example of the way that the policy framing that helped SIPHER to be speaking to the audiences that might be able to make change actually was a real challenge for work with the panels.
Really interesting, and sort of is a really good example for why this is so important. We've got time for one final question and a fairly short answer. Were there any unexpected insights from the panel members?
Oh, so many, and there's no short question, no short answer to this. So many unexpected new ways of looking at issues that I hadn't expected, and certainly that I think the researchers hadn't expected. This is definitely not a short answer, so I'll just throw it out there and run away, as it were. The ability of the big data sets we work with to capture difference by ethnicity was a hugely significant factor that especially members of our Sheffield panel, was a cohort of Black British members of that panel who were really vociferous about the way that big picture modelling work doesn't capture racism or understand racially differentiated effects, would be something that I think in some level I would have expected, because we know that race is a huge determinant of lots of outcomes in society, but the way that it can become a blind spot in big data projects, that to me was an insight that was quite fundamentally shook my understanding of what our responsibility is as researchers. And I'm excited for us to try and improve some of that in future research.
Thank you so much, Ellen. And thank you all for joining us for today's webinar and for all your questions. A full recording, as I said, of today's webinar will be available soon on the SIPHER website. So please keep an eye out for that and feel free to share it widely. Our next SIPHER webinar is going to be on measuring economic inclusion for local authorities and wards in Great Britain. And that's on the 4th of December, again at 12:30. That's a Wednesday. In this session, Dr. Hugh Rice, SIPHER researcher and research fellow at the University of Leeds, will introduce SIPHER's inclusive economy dataset and explore how this dataset can inform policymaking at the local level. We hope you can join us at this and future events. Thank you again. Take care and have a great day.